Hey guys, I'm Dr. Robert.
And I'm Dr. Natalie.
And welcome to our low back series.
Today we're going to talk about a series of low back rehab exercises, stretches, and activation tips to help combat your biomechanical low back pain.
So thank you very much for joining us. Please subscribe if you found this beneficial. And again, this is for informational purposes only. Always ask your healthcare practitioner before starting a new stretch or rehab routine.
Today we're going to start with foam rolling the quads. To do so, you're going to lay the foam roller horizontal on the ground and lie over it as if you're in a plank position. Start the foam roller mid-thigh, and then you're going to keep the core engaged and roll towards the knees and then back up towards the hip. You'll repeat this 10 times, and then you're going to turn your toes in towards each other and do another 10 reps, and then out away from each other and do an additional 10 reps. While doing this, you want to make sure that you're staying off of the kneecap and you're not experiencing any tingling or numbness.
Okay, so now we are going to foam roll the glutes, mainly the piriformis muscles. So we're going to lay that foam roller down. Natalie is going to take a seat on the foam roller, and she's going to cross one leg over the other. Now she's going to start doing 10 passes back and forth slowly. Now it's important to note, if you find a really tight and tender spot, you can really focus in on that area. You can really just kind of go a little bit deeper on the spot and make your passes a little bit shallower and a little bit faster to really start to aggressively treat that area. Now, if you feel any numbness or tingling, it's a good idea to get off that spot because there is a big nerve called the sciatic nerve that comes right through this area. Now, feel free to play with the angle. You can lean a little bit more to the outside or to the inside. Again, trying to find that area of most restriction and really trying to even out some of the tightness. A lot of times this gets tight from running, from sitting, or all of the above.
The next stretch is called the couch stretch. It's to open up your hips and take pressure off your low back. You're going to start by bending your knee and placing your shin along the back of a couch cushion or bench, couch, or chair with your toes pointed upward. You keep your thigh in line with your body and place the other foot in front, aligning your knee above your ankle. Elongate your spine and engage your core and glutes, keeping the hips square. Hold for up to a minute and then switch sides.
So if the couch stretch causes too much discomfort, there's a different modification you can try. This is called the lunge stretch. So to do this, after you're doing a lunge, we're going to come all the way down to the ground. Putting one knee on the ground like so, and slowly bringing the hips forward. You should feel a nice big stretch through the front of the thigh, engage the core, and also engage the glutes. To make this even more effective or a bigger stretch, take one hand, actually the right hand, over the top of the body like so. Hold for 30 to 60 seconds. Now, Dr. Natalie is going to demonstrate the knee to chest stretch. This stretch is really beneficial for reducing stiffness and compression in the low back. To do this, lie on your back with both knees bent and feet flat on the floor. Gently raise one bent knee up, enough to grasp the lower leg with both hands. Interlace your fingers just under your knee. Gently pull that bent knee towards your trunk using your hands. Try to relax your low back and pelvis as you pull. Hold for up to 1 minute and repeat on the opposite side.
Now that we've stretched the front side of our legs and hips, it's time to activate those glutes. You're going to lie face up on the floor with your knees bent and feet flat on the ground. Keep your arms at your side with your palms down. Start with a pelvic tilt and then lift your hips up off the ground until your knees, hips, and shoulders form a straight line. Squeeze the glutes to keep your abs drawn in so you don't overextend your back. Hold your bridge position at the top of the movement for 3 seconds before slowly lowering back down to a count of 3. Repeat 3 sets of 10 reps.
Okay, Dr. Natalie wanted to do this exercise because she said she's really good at pelvic tilts. So pelvic tilts strengthen the core. It's good to have mobility, but it's also good to have stability. So to do pelvic tilts, you're going to line your back on the floor with your knees bent. Flatten your back against the floor by tightening your abdominal muscles and rotating your pelvis slightly towards your rib cage. You should feel your back flatten out towards the floor. Hold for 10 seconds and repeat for 3 sets of 10 reps. All right, so we're going to continue to activate the core with this next exercise. This exercise is a modified dead bug exercise. The reason I like this exercise so much is that it's going to retrain the neuromuscular system. It's going to allow these smaller stability muscles in the spine that typically don't get used to get activated in a coordinated fashion. So to do this exercise, Natalie is going to lie with the foam roller vertical. She is going to lie with the foam roller vertical along her spine, supporting her head and tailbone on the foam roller. Rest your arms alongside your body with your knees bent. Your core muscles are also engaged as you press your low back into the foam roller. There should be no space on the foam roller. Lift your right hand and left knee opposites toward the ceiling. Lower your arm and leg down to the starting position without disengaging the core or losing the space between the foam roller and your low back. Do 3 sets of 10 reps. And if you don't have a foam roller, you can also do this on the ground. And we could have stopped, but I wanted to see Natalie keep doing it. Hey guys, we hope you enjoyed the low back series video. I'm Dr. Robert.
I'm Dr. Natalie.
Thank you so much for joining us. If you found this beneficial, please share with a friend. Also subscribe to our YouTube channel and also follow us on Instagram at Fredrickson Health Solutions. And you can also find our website at fredricksonhealthsolutions.com. Thanks again, guys, and let's stay healthy and pain-free.
Bye.